Hi, John Martin. I'm Chief Executive of SWASFT Ambulance Service. Again, we're talking about health, wellbeing and high performance in emergency services. Obviously focusing on my experience of 25 years in the ambulance service, how ambulance services do it, hopefully with a bit of a link into what that might mean for fire, police, coast guard, other emergency services and how we go. I'm pretty much going to be talking about the concept of mattering, what makes us feel like we matter, and how do we get that right as leaders in emergency services, and if we do get that right, does it improve our performance? So the answer is yes, it does improve our performance. There's some pretty good evidence-based research now that Oxford University have a Wellbeing research centre who've looked at this, that if you get it right for people, if we have a good culture, we actually perform better for our populations as we do that. So going to be taking us through some of the research on that. Going to show us a little bit of the NHS staff survey results. So we're not very proud of these really. So ironically talking about wellbeing, but we're not getting that right. And I'll link back to our we don't talk about it much anymore, but COVID, which feels like a long time ago. Children who were born in COVID now very definitely in primary school, but yet that, if we think about the way we as emergency service deal with disasters, that was a big disaster and we're probably still in the slump of recovery from that. So what does that mean for us as leaders contextually, and how do we focus our efforts on that? I'll probably touch a little bit on the Royal College of Paramedics, which is our professional body. Don't know how dissimilar that is to some of your associations you've got set up, and also the Association of Ambulance Chief Executives and some of the tools we're putting together. So hopefully be some good take-homes for people of things that they could try in their local emergency service, whether that be fire or any other. Well, I think the first one, I'm a bit of a lover of data and information, is I don't think although we might have had it, we haven't really seen what it's been saying. So certainly in the NHS, that's twofold, and we're seeing that in some of the inquiries. So there's what happened to our patients, the ones that we were looking after, where there clearly was discrimination that went on. That's just not right, and that shouldn't have happened. And when we look at our staff survey, we can break it down by a whole load of characteristics, whether that be ethnicity, religion, sexuality, etc. And again, we get variation in how different groups are feeling about how they're treated. So I think using the data as our insight to really be curious with each other on, well, what is it we're seeing here, and what have we built into our systems and our processes that make that a reality for whether that be our patients or our staff, and we then need to work differently around that. So there's clearly a personal responsibility, but I think when you ask about executive leadership, it is about, can you understand the whole of what's going on in whichever organisation you're responsible for, and then what actions are you taking? I was born in Luton, grew up in Luton, then worked for what was Bedfordshire and Hertfordshire Ambulance Service, moved to East of England, then went to London Ambulance Service, and now I've moved from London Ambulance Service to South West. So when we talk about diversity, quite different bits of the country and world that I've experienced in terms of both being a leader and living in them. And it's obviously massively important to how we understand, how we connect with our communities, but we do know that inclusive organisations, ones that have high respect and belonging, and going back to this topic I'm going to touch on today, mattering, if you feel like you matter to other people, you feel like you belong, and then you deliver, and that is really important as a construct, but whatever background we're talking about, that you feel like you've got a place here. So that focus is important for lots of reasons as a leader. My first time at this conference, so I was interested, had a talk with one of your colleagues a month and a half ago, so you can tell me a bit about what it is and what happens. I think we probably don't do enough of it, sharing between different services, so ambulance and fire, ambulance and police. We do quite a lot of ambulance conferences, so I think that how do we learn from each other is important, but also I love a bit of knowledge and a bit of research and a bit of insight. This is a good opportunity, isn't it, to come and share, and just even if people only take one thing away from my or anyone else's talk, and that gets them a bit curious, and they go, well, I'll go and explore that, I'll go and do a little bit of reading on that, that might change their practice. That's actually how we change the world, that's how we change our behaviours.